Hi, and welcome to this yoga class to relieve back pain during pregnancy. My name is Cassie. I'm a prenatal yoga teacher and exercise specialist. And although I am not currently pregnant, I very much remember times when my back was cranky from my growing belly and changing posture during pregnancy. So today's practice, we're going to be doing some stretches to provide relief, as well as strengthening exercises to keep back pain from continuously reoccurring. If you like today's practice, please consider subscribing to my YouTube channel. I release a new video here every Monday. And for today's practice, we are going to be using 2 yoga blocks. If not, you can still do the class without. It's just going to be more accessible with these 2 blocks. When you're ready to get started, come join me on the mat. We're going to begin by sitting on 1 or 2 blocks. I personally love to sit on 2 yoga blocks. That can help to relax your hips and bring length to your low back and to your spine. And then bring your hands, 1 to your belly and 1 to your heart. Take a moment here to connect with your body. Connect with your baby, and start to feel the rise and fall of your breath into your hands. Take a couple more breaths like this. Inhale, expand the ribs, fill the belly, the chest, the back. And then exhale, letting everything go as you maintain length in your spine. And then you can bring your hands back down to your lap. And we're going to take some TVA or deep abdominal strengthening exercises. So you'll take another big full inhale, breathing into your sides, your belly, your back, all the way down to your pelvic floor, so really all the way around. And then as you exhale, I want you to think of hugging your baby in towards you, breathing out of your mouth. So it'll look like this. Big inhale, exhale. And so we're going to take this for about 5 rounds. Activating these deep core muscles helps to give your back some support. So take a nice big inhale, fill the sides, the front, the back, all the way down to the pelvic floor like a balloon. Exhale out of your mouth as you think of lifting and hugging your baby in. Inhale, expand. Exhale, lift up and in. Get all that air out. 3 more. Big inhale. Exhale, lift, hug baby up and in. Good, nothing should be happening in your back, all in the abs. So it's like you're drawing baby in at the same time, lifting them up. Last one, big inhale. Full exhale. And then let that go. Reach your arms up. And then take a side bend, bringing the left hand either down to the floor or just down to your leg, reaching the right arm up and over. And then go ahead, switch to the other side. And if it feels more comfortable at this point to come off of your blocks, you can totally lower down to just 1 or no blocks. So just start to flow like this, side to side. Open up between the ribs. And feel like you're lifting out of your hips, so up and over, focusing more on the up than the over. Shoulders are relaxed. Neck and face are relaxed. Let's take 1 more each way. So really reaching up and over. Reaching up and over. And then come onto your hands and your knees, bringing your blocks underneath your hands. You can take them right now to the lowest setting. If you're further along, you may find it more comfortable. It'll be a little bit easier the higher you lift your blocks. And then from here, just start to take some circles with your hips. So start to move your hips around. These circles can be small, especially if your back is actively bothering you, which is probably why you clicked on this class. Make them small. And not forcing anything, but just inviting in a little bit of freedom. Good. Exploring where you feel it in your back. And then you can allow the upper body to come into the picture, circling it out, arching and rounding your back. Take it in both directions. And then come to a flat back. So you're neither rounding your back nor are you arching. Just a nice flat, neutral spine. Gaze between your hands and coming into bird dogs, taking that same exhale like we did activating the deep core, you're going to be reaching your arm and your leg away on that exhale. So here we go. Take an inhale, fill the sides. Exhale, hug baby in as you reach right arm forward, left leg back. Strong leg, strong arm. And then come back to the ground. Inhale. Exhale, hug the baby in a second before you lift the arm and leg away. And then just keep going like this, side to side, nice and slow, actively pushing through the bottom arm, engaging your back glute. And every time you exhale, resisting gravity by hugging your baby up and in. Let's take it twice more on either side. Good. So you notice that you're not, as your arm and leg move away, your back wants to arch. You're resisting that by hugging the baby and pushing the ground away. Good. One more each way. Sometimes the slower you go, the more that you can find that. Notice how your body wants to cave in. You push it away. And then come back to all fours. From here, come to lay on your left hip. You can either take a block underneath your head or lay all the way down. I actually like to support my head with my hand. And then if you're further along and you need a little bit of support under your belly, also know that you can bring a rolled up towel or pillow underneath your belly. From here, bend your bottom knee, bring your top hip on top of your bottom hip, and then start to flex through that lifted leg. So working into our side glute here, you're going to start to lift that top leg up. Knee and toes stay facing forward. So it's not about height. You're not taking it way up here. You're keeping that knee pointed forward, feeling the activation in the side glute, and then lowering back down. So we'll do about 10 of these. Lifting up and lowering down. Work on keeping the hips stacked. Breathing out as you lift, hold it for a second at the top. Good. Having strong glutes, so this is our glute medius, part of our side glute, is so important for being able to support our pelvis and our low back as our joints and ligaments become more lax with pregnancy. The hormones make your joints and ligaments more lax, obviously to prepare for childbirth, but having these nice strong glute muscles will help to just bring some balance to that area. Otherwise, other muscles try to kick in to do the work for your glutes. Good. Keep lifting up for 3, for 2. On the next one, keep your leg lifted, point your toes, and then just take little circles back and back. Think of hugging your baby slightly in here. Support from the core. For 3, for 2, little circles, 1, reverse that. You're staying low, focusing on that outer glute. For 2, and for 1, flex your foot. Now bend your knee in towards your chest. Start to extend your leg forward. If you can't extend it all the way, totally fine. You can keep the knee bent. And then as you exhale, start to sweep your leg behind you, maintaining that top hip over the bottom hip. So you're not falling back nor forward. Let's go for about 3 more of these. Bend the knee in, try to kick through that heel, and then sweep it back, pointing your toe. 2 more. Bicycle it in. Extend and bring it back. Last one. It's okay if it's small. It's more important that you keep those hips where they're at and sweep it back. Good. Go ahead, lower that leg. If you need, give that glute a little tap out. And then come to your hands and knees again. Bear circles. This time start to take your hips back towards your right heel, over towards your left heel, and then back up to hands and knees. Good, just big circles. And try to get your right hip past your heel, and then left hip past your heel before you come back up. And then go ahead, reverse that. Take the hips back past one heel, past the other heel. Good. 2 more. Last time around. And then we'll come on to the other hip. So this time coming onto your right hip, bend your bottom knee, support your head. Again, you can take anything underneath your belly to give it a little more support here. Trying to resist that arch of our back. So pulling, rounding the hips slightly under. And then flex through that top leg. Let me move some blocks out of the way here. You're going to start to lift it up and lower. Not about height. It's about keeping your knee and toes facing forward so the leg just goes straight up and down. Excuse me. And hold it for a second at the top. Sometimes it can help you to bring your hand to the muscle that you're working to make that mind muscle connection. So taking it right to like the side back part of your glute. For about 6 more. I like to think of these muscles here as kind of like giving the pelvis a nice little hug. And saying, I've got you. And of course, the pelvis is connected to the spine via the sacrum in the back. And so we have our 2 little SI joints on either side that when something wonky is happening around in the pelvis, then that tends to fire up those little SI joints, which gives you that pain in the back. So these nice side glutes are just keeping everybody happy. And let's take 1 more and then leave it up at the top. Point your toes and start to take little circles and circles. Perfect opportunity if the intensity builds to breathe with it, to surrender and go with that sensation, welcoming it in. Good practice for childbirth. And then reverse it, little circles for 4, for 3, for 2, for 1. Flex your foot again, bend your knee in towards your chest, and then extend through the leg. Point your toes, sweeping the leg behind you without letting the top hip rock back. 3 more times. Bend it in. This should feel good. Nice stretch on that outer glute as you extend it forward, and then point and sweep it back. 2 more. Think of kicking out of that heel. And last one. And then come back to hands and knees again. Grab a block, bring it between your inner thighs. You can bring it either sideways or skinny ways, just depending what feels better for you. Good. This will help to stabilize the pelvis. So squeeze in on the block, activating those inner thighs, and then reach your right arm up to the ceiling. So the movement is happening here from your thoracic spine, your mid-upper back. As you exhale, start to reach that arm under. And it might be small, especially if you're navigating a big belly there. Good. Breathe into your back. A little bend in that bottom elbow. And then take that up again. Breath in, reach up. Breath out, reaching under. 1 more time, reach up. And this time we're going to come all the way down, bringing your shoulder to the mat, head to the ground. You can tuck your back toes under to give you a little bit of resistance so you don't feel like you're falling forward.
And then your left arm can either reach forward, or you might find it feels really nice to wrap it behind your lower back. Stay here for a couple of breaths. You're using that squeeze in of the block to keep your pelvis relatively level, so one hip isn't coming higher than the other, and instead this movement's happening from that upper back. And then bring your left hand by your face. Come back through center, switching sides. Left arm reaches up to the ceiling. Inhale. Exhale, little rotation under, reach. Good. Breathe into this back. And then reverse that up. Inhale. Breathe out as you reach. One more, reach up. This time, come all the way down. Can rest your head if you feel like you're falling forward. Hips can go behind the knees slightly. And then you choose if you want to extend your right arm or wrap it behind your back, opening up through the front of that shoulder. Take one more breath. And then come back to all fours. Place the block off to the side. And let's find a downward facing dog. Press strong through the hands. You can pedal out the legs. Let the hips move side to side. And then as you're ready, slide your right knee towards your right wrist, coming into half pigeon pose. Left leg will slide behind you. And then it's less important that your shin is parallel to the front. It does not need to be parallel to the front. It's more about your hips being level to the ground. So if you have a big space between your glutes and your yoga mat, or if you're hyper flexible, it's a good idea to take a prop like a block and bring it under your hips so you're not going to your very deepest stretch. And then you can, depending on how things feel here, how big your baby is now, you can either just stay on your hands, you can come to your elbows. If you happen to have a birth ball, this is also a nice place to take a birth ball and hold on to it. Now using this opportunity to relax, to let your body drop. And so we're stretching out one muscle called the piriformis muscle, which kind of sits like right in the middle of your glute on either side. And when this muscle is tight, it can compress or irritate the sciatic nerve, which can lead to that pain that radiates down your back into your glutes, sometimes down your legs as well. So we're stretching that, opening it up. And then the reason that we strengthened our glutes is so that our big glutes can do their job, so that our piriformis muscle, as well as other smaller muscles, aren't working so hard to try to compensate. And then take your time to come out of the pose, and then we'll switch to the other side. You can come right into it or go from down dog. Take your left knee towards your left wrist, Bring your right leg behind you. And then once again, you can bring a block underneath your left hip. See how that feels? Or do it without the block. Up to you. As long as you're getting that outer glute stretch and you're not overstretching. Slow down your exhales. And check in with your neck and your face. And you can always lower onto your forearms. Or again, if you're towards the end of pregnancy, you can hold onto a birth ball here or something similar like that to relax your upper body while giving you enough space. And last few breaths here.
This time is for you. There's nothing else you need to be doing right now. We have to take care of ourselves, take care of our body so that we have the strength to do everything else, to take care of everyone else, especially little ones that want to be picked up a lot. And then come back up to your hands. Come to all fours. And then let's have a seat. Open your legs out wide, but not too wide. So just into like a big V. And then you're gonna walk your arms forward. You can either stay in stillness or find a little bit of movement side to side, just now opening up those inner thighs. And then come all the way up. Let's close our legs, either sitting cross-legged or feet together. And then we'll end with just a couple of circles here, taking the chest and the hips around. Big circles one direction. Big circles the other direction. And then find stillness, just like we started, hand to heart, hand to baby. Take a moment to notice how your body feels right here. Any changes from the start of class. And remembering that things take time, patience, and consistency. And then take one last big breath into your hands. Exhale, let it all go. And then open up your eyes. Thank you for joining me today for this short yoga class for back pain. I hope that it helped. If it did, please let me know below in the comments. And again, if you can consider subscribing to this channel, I release a new video every Monday. Another great video that you can check out is my prenatal core video. Strengthening the core is also, our low back is actually part of our core, so strengthening it can help with that support to help relieve pain. Thank you, and I hope that you have a wonderful day.